Well, great. Thanks everyone so much for being here. We're so excited for this instance of Summer of Health. I'm going to stop sharing my screen and we'll do speaker view. All right. Great. Well, I'll get us started. They can even see you guys here a little bit on camera. You have your own camera, so behave yourselves. I'm kidding, but we'll get started. My name's Katie. I'm the alumni coordinator for the College of Health Solutions, and this is Summer of Health. And how we designed this Summer of Health series was we wanted to give people an opportunity to not only learn something new about how to incorporate health into their life, but also highlight the ways that our alumni are advancing health in the community at large. So we get them for a season and then they go all over the place, and it's fun to hear what they're doing and the things that we practice every day here on campus that they're doing out in the world. So today we're so lucky that we have Dr. Steph Mundt with us. My favorite thing about her is that she is a Sun Devil through and through. And I love ASU, but so does she. And while she was on campus here, she spent time running track, cross country, as well as completing her kinesiology degree here in 2012, and then went on to become a physical therapist, to start her own practice. And I'm going to let her share a little bit about that. But today she's going to teach us all about how, a little bit about her experience while she was a student, and then about how we can stay safe and avoid injury while we're working out. So Steph, I'm going to turn it over to you. Can you just give us a little introduction, tell us a little bit about you?
Yes, absolutely. Thank you, Katie. So as she mentioned, I went to ASU from 2008 to 2012, and I was on the track and cross country teams. I'm originally from Iowa, so I came all the way out here to be a Sun Devil and get away from the cold. And my experience was great on the team, but I was injured quite a bit. So that led me to be in physical therapy myself. And a few years down the road, decided to go to physical therapy school. Unfortunately, I did go to USC for physical therapy school, but we need ASU to get one. But I got an experience, a little spying on another Pac-12 school there, and then came back to Arizona and started my own physical therapy practice. And right now I treat all kinds of injuries, but really emphasizing working with female runners, as well as just working with females who have been injured in the past and want to learn how to get stronger in a safe way.
That's awesome. And we wholeheartedly forgive you for briefly going to USC, but we're glad to have you back. Can you tell us a little bit about what was your experience? We've talked enough about USC. What was your experience just as a student at ASU, being an athlete and a student at the same time, and what that kind of looks like, what that kind of means for your life now and your practice?
Yeah, absolutely. So it was very organized, and I felt like I had just an immediate friend group being on a team. So that was helpful. But even outside of that, the kinesiology program was great. I was on the Tempe campus. I think it was one of the last years that it was on that campus. And my professors, my classmates were all awesome. And I think it really prepared me well for the path that I was going on. And yeah, just being part of a team, going to football games, going to basketball games. It was all just, like you said, Sun Devil through and through. And easy choice every time I see USC playing ASU, an easy choice who I'm cheering for. So I had a really great 4 years here.
That's awesome. I know, I also think it's funny that we think we're in a rivalry with USC, and I don't think they think of us at all, but that's So you talked a little bit about how the focus of your practice now is with women and women runners and kind of how you got there, but can you tell us a little bit more about that, and really how much of a difference is there between what a female runner versus male runner might need?
Yeah, I think the unique needs of the runner in general from other athletes are the basically the similarities between what runners need for a treatment perspective as male and female is more similar than what a, females, what am I trying to say? So runners in general need a certain type of treatment, but females, I think as a whole, I know there are some males in here, so I want to speak to you too. The healthcare system is just not set up for prevention. It's really set up in a reactive way. And many of us, and I'll ask, for input during the later part of this session, but many of us are told things about our bodies that aren't helpful, why we've gotten injured, there's something wrong with us, or we're built wrong. And it's just really I think anti to us getting better, or it decreases our chance of getting better because we believe or are told that there's something wrong with us that needs fixing. And so I just really stand for better treatment overall in healthcare, more transparent treatment, and especially for females, and specifically since I'm a runner, females who run.
Yeah, that's exactly what we talk about every day here is, what does health look like from all perspectives? Are we talking to each other? How does diet inform fitness, inform overall health? And I just think that's cool. I think the more prevention we can have, the healthier we can be. So you pushed it all the way through PT school. You started a practice, you have this focus, you do a lot of pouring into other people in different ways. How did you, tell us the story behind the drive to start a business, to invest in other people, and what kind of values guide you to do that?
Yeah, so I think like many people, our personal experience kind of drives what we want to see change for others, or have others not experience our same situation. So I had an eating disorder in high school and into college, and that led to multiple stress fractures, so poor bone health for a few years. And it just kind of felt like, again, we didn't really go the route of the lowest hanging fruit, nutrition, sleep, what was going on there. It was like, oh, you have a leg length discrepancy or something else is going on. And so it wasn't really a holistic type of care. And that definitely impacted my trajectory through the 4 years as a member of the team at ASU. And that's, I think, pretty rampant, unfortunately, for high school and collegiate female runners is finding something else that's going on rather than addressing kind of these root causes. And then finally, basically in 2018, I injured my hip, and again was told that, you have a weakness in this glute, and that's probably what's happening. And I started seeing a physical therapist myself to help me with this hip pain. And she had her own business and was a coach as well as a physical therapist. And I started to see that, oh, I can actually do this as well. And it was different than the traditional model of, 3 times a week for 6 weeks. We met once a month for several months and talked a lot about what my pain meant to me, and really what I thought was reasonable activity wise and strength wise as I went through the next few months. And that just really changed my perspective of pain and injury, and really what my body's capable of. I had a labral tear in my left hip, if anyone's had something like that, and I did not get surgery, and I'm doing completely fine now. So that really led me to think, okay, I can do this for others, and just started it.
And here you are. See, Sun Devil, we just do things. We just get things done. That's what we do. It's interesting as you're talking. I think that's really what we're seeing play out right now. If we look at the Olympics, and if we look at the gymnastics team, playing out that balance of pushing yourself so hard as an athlete, but at what cost to your physical and mental health. I know I didn't ask you this before, but I'm wondering if you have thoughts on, the female Olympic athletes.
Yeah, I mean, exactly what you said. I think we're finally getting to the point, like Simone Biles, obviously, where speaking out and saying like, this is not for me anymore. And seeing the reactions it's tough, because she is, obviously that was a very difficult decision. And she's, treating herself now as a human first, athlete second. And so I really respect her for that. And I think, Michael Phelps has come out speaking about mental health issues in Olympic athletes as well, and stuff that I don't think we really considered before. You know, they're the pride and joy of our country and they should be performing. and so I think that hopefully that narrative starts to change with more and more speaking out on the importance of taking care of your mentality and your emotional health first.
Yeah, totally. Yeah, you know, Carrie Strug was competing when I was pretty young, and I remember thinking that was so cool, you know, that she could land on one foot. But looking back, it's like, why did we make her do that? It's like, she was clearly in so much pain, and that's just interesting. I think, especially how we treat athletes at any level competing. I'm thankful too that that kind of holistic health is coming back to life, or coming into the conversation, what I meant to say. All right, well, wondering, just kind of a last fun question, if you have like a best ASU memory from the time you were here.
Yes, so I have two. One is not from the time I was there, but I think you'll all appreciate it. But while I was there, because of my struggle with injuries, I think one of my very favorite memories was running at Pac-10s at the time at UC Berkeley. And just being able to compete finally, it had been 2 years where I wasn't healthy enough to run. And they allowed me to race even though I wasn't really in that good of shape. I'd been training for 2 months. So really thankful to my coaches for that. And that experience was awesome. Another favorite ASU memory was after, when I was at school at USC, and some of you will probably remember this game. ASU came to USC, and it was when Jalen Strong threw the Jail Mary. We won at the last second and just went wild. That was pretty great.
They won a USC game when I was in school, and we rushed the field, and I literally made it 2 feet onto the field before my foot caught a divot, and I smacked into the ground and knocked the wind out of myself. It was very embarrassing. But we did.
Really good memory.
I was like with my sister, and she was like, "Gosh, like this was a cool moment." You fall on your face. But we still beat USC. So. Yeah, I think anytime. Yeah, that was an amazing season. Cool. Well, we'll have plenty of time for questions afterwards from both people here and people joining us through Zoom. So if you're thinking of questions, go ahead and you can leave them in the chat now, and I'll kind of monitor that. But from here, I'm going to turn it over to you, Steph, to teach us a little bit about injury prevention and how we can be the best runners we can be, so I don't fall on my face.
Yes, that one may not be preventable. I'm not sure about that. All right, awesome. So I'm going to share my screen here, and for kind of the middle part of the presentation here, you will want just a tiny bit of space to be able to stand up. You won't have to move around a lot, but you may want something also close by to hang on to. So not to scare you in any way. And you don't have to participate if you don't want to. All right. All right, everyone see that?
Looks great.
All right, perfect. Okay, so as Katie mentioned, now we'll kind of get into why you're here, which is to talk about injury prevention and management for active adults. And again, I work not exclusively, but primarily with female runners and athletes. And it's my opinion that if you move your body in some way, you are an athlete. So this is really for anyone, and also applies to males. All right, so, and again, you know, we touched on this a little bit, but why I wanted to discuss this is because there is an overwhelming amount of information, some of it misinformation, on how to manage once you're injured. I'm sure many of you have given to Dr. Google or Dr. YouTube after an injury to diagnose it or to find ways to make it better. So really the goals here, I want to address that misinformation and help you get the most up-to-date information on how to manage injuries, and really leave you with a sense of empowerment in your own ability to heal. So I'll be asking some questions throughout. So if you want to join in, I'd love for it to be more interactive if you'd like. And you can either just take yourself off mute and respond, or you can raise your little Zoom hand. And then Katie, can I have you call on people if they raise their little Zoom hand?
Oh, absolutely. And we do too have a microphone for those joining us live.
Perfect.
We want to run around if anyone has anything they want to contribute.
Perfect. All right, so to start off, injuries, obviously why we want to avoid injuries is because they stop us from doing the activities we love. You know, oftentimes we can deal with pain, but when it stops us from doing something we love, that's when it's a problem. And so it can have a significant impact on our quality of life. So how many people have been injured? And to specify, we're talking about some kind of muscle, like a soft tissue injury, muscle, tendon, ligament, bone, hands. I see some in the...
We got a lot of hands coming up live here.
Okay, does anyone care to share what's been injured? Still have hands up, I think, from, are those wanting to tell us about your injury, or are those just still up from, yes, you've been injured?
Yeah, Melinda or Elaine, you want to share if you're comfortable with your injury story? Yeah. We got someone live in the house. All right, Audrey's going to share with us a little bit about hers.
Awesome. Thanks, Audrey.
Oh,
I can't hear her.
So an ab injury you said, and then the first one was what? Pelvic congestion syndrome from ab workouts, from a CrossFit workout.
Okay.
Dang.
Activity.
And then it looks like some other people, we've got hips, feet.
Okay. Oh, in the chat. Perfect.
Knee and hips, some lower back,
Okay.
shoulder, ACL. Yeah, go for it.
Okay, good. So we have a big sample size, a lot of people. So I'm guessing a lot of you are pretty active too. Generally, if you're sitting on the couch all the time, you're not going to get injured. So, all right. So thank you for sharing. Let's go to the next one. So this is just a disclaimer, basically. If you get injured doing this, it's not my fault. So everyone can agree to that. And we'll move on from here. All right. So I hope some of you like Schitt's Creek, because you will see many GIFs throughout this presentation of this. But really, why do we get injured? You can put some guesses in the chat, or really, why have you been told? You know, a lot of you have had injuries. What is your perception of why you've gotten injured?
Yeah, I've always heard like you try to go too hard too fast, like you're trying to start a new workout and then you don't know what you're doing.
Absolutely, yeah. Anything else? Anyone else in the chat? Let's see. What do we have?
Overuse is not my issue, but I'm impressed with the athletes that it is.
Overuse, yeah.
We have live feedback. This is so exciting.
Great.
Oh, just clumsiness.
Clumsiness for sure, yes. Awesome. Anything else?
Yeah, I mean, lots in the chat, not warming up or not stretching. Oh, improper form.
Proper form, that's a big one. Good. Yes, you're absolutely right. Now, some of the things, no one said this, which I'm super happy about, but tell me if anyone has heard this. Has anyone been told this is the reason why they've been injured? Any hands or any of these things?
Seems to be resonating here.
Hey, yeah. So unfortunately, many people are told that their pain or injury, again, kind of like we touched on earlier, is due to something wrong with you. You move wrong, you were made wrong, and there's just something that's really not fixable. So you're going to have to work hard for the rest of your life for this not to be an issue. Does that resonate with anyone? Yeah, so unfortunately, these are common narratives that we hear, and they're just, they're definitely not empowering. If you have flat feet, it's kind of difficult to fix that. You can get inserts, that kind of thing. If you have a bad back, again, what can we do for that? So unfortunately, again, we hear this a lot, but these have been researched, even though they're still common narratives. And even when these do exist, Maybe you do have a weak core, maybe you do have flat feet, maybe you do have some degenerative discs in your back. They play only a very small or no role in pain or injury. Glutes not firing actually isn't really possible unless you've had a neurological injury, so don't worry about that. So the fact remains that our bodies are able to adapt to the loads that we place on them. So we just have to make sure we're doing an adequate progression and get recovery. So at the most basic level, and you touched on this with overuse or getting into something too quick, load exceeds capacity. So basically we apply a load that's much greater than the capacity of our tissues to adapt. We're more likely to get injured or have pain. If we're to apply that load slowly over time, then our tissue makes adaptations and our capacity increases as well. So your bones become more dense, your tendons become more resilient, and your muscles get stronger. So when that load is applied faster, then they can adapt, then tissues can adapt, such as starting a new exercise program, just gung-ho, 5 days a week, high intensity all the time, you're more likely to be injured. So what we want to do is build our capacity so that when we introduce load, new activities or different exercise programs, our tissues can tolerate it and hopefully we don't get injured. Now, clumsiness comes in and it can kind of put a dent in this sheet. That might be a quick load that your body's not used to, and you may still get injured from things like that. But generally speaking, with exercise and activity, if you work on building that capacity over time, you're much less likely to get injured. So I'm sure you're all doing this right now. So Steph, how do we increase our capacity to reduce our injury risk? So nothing super crazy here. You gradually do more of the things you want to do. So something called graded exposure or progressive loading. Elaine, do you have a question?
Maybe she's just really excited.
Yeah, okay. So if you want to run a marathon, you start by running, or actually probably walking first if you're not used to that, walking a mile. Then you can do a run walk interval, then you run a little bit further. Same thing with CrossFit. You'd start off with body weight, learn good form, gradually progress your weights. In addition, you want to optimize sleep, nutrition, and managing stress. Those are things that can decrease our capacity. So if we were at the same load, same exercise routine, but we got sick, we lost sleep, we're super stressed at our job, that will also increase your chance for injury. In addition, what we'll do next, you can do an evaluation of your own basic movement patterns and strength and stability, so you can find these possible opportunities for improvement that also could be worked on and decrease your risk for injury. So that's what we're going to do next. So stability means the ability to effectively transfer load from the outside world to your body and from your body to the outside world while staying in control. I think everyone's probably felt unstable, you know, if you stand on one leg and start tipping over, that kind of thing. So we're going to assess stability, and then strength is your ability to, or your capacity to overcome a force. And strength is a little bit harder to quantify when we don't have equipment, but we'll be able to get a little bit of an idea of some body weight strength with these exercises. So with everyone stand up, we're going to start with single leg balance. So what you're going to do, going to lift up one leg.
Here, can I make her
I'll start a timer. You want to hold it for 15 seconds on each side. Notice if you got any wobbliness, and you want to try to do it without leaning over and without losing your balance. Okay, 5 more seconds on this leg. Just notice what you're feeling.
But
Good. All right. Did everyone manage that? Go ahead and switch legs. You will likely have one leg that's a little bit more challenging than the other one. Okay, you might also notice that your ankle's wobbly, you're leaning. But generally speaking, 15 seconds is going to be good. Sometimes it'll try to go to 30. Good. Okay. So that's balance. It's looking primarily at stability and also a little bit of hip strength. Now, this is where you might need something to hang on to. We're going to look at calf strength. Okay, so if you have not done a heel raise in a long time, this is where we come back to our graded exposure. Try a double leg heel raise first, 2 legs. Okay, and heel raise just means lifting up onto your toes, raising your heel up like this picture. And you're gonna try to do as many as possible. The goal is 20 each on each leg, or 20 on each leg, without losing height, without bending the knee of the leg that's working, and without using momentum. All right. So let's start, everybody start on the right leg. This also may be a workout for your calves. You're gonna try to get to the same height, keep a steady rhythm, and try to get 20 on each leg. We'll give you about 30 more seconds to do that. Doing it too. Might be feeling a burn. All right. If you fatigued or you lost height, go ahead and stop and switch legs. And you're gonna do the other one. If you've had recurrent ankle sprains on one side, you might notice your calf's a little bit weaker on that one. Or maybe an Achilles issue, that one might not be as strong. Give you another 30 seconds to finish up this side. And if you're hanging on to something, try not to push down on it like I was just doing, just to cheat. All right. How's everybody feeling? Calves burning?
Yeah. It was like holding onto that chair for dear life.
Yes, that's one we don't commonly do. So if you're sore, that's okay. We'll talk about how to deal with that a little bit. All right, after that, we're going to do, now if you have difficulty with balance, make sure you're standing next to something here. So this one, you're going to pull one leg up towards your chest as high as you can. And then, oh, let me change this a little bit. And then once you let go of your leg, oh, balance. You're going to try to keep that other leg there the same height and hold it for 10 seconds.
Yeah, that's what I'm saying.
That one's pretty challenging, okay? Then try the other side. You might also notice that it's hard to get your leg up. That's a flexibility issue. And then hold. Try to keep it at the same spot for 10 seconds. Again, you can hang on to something for balance if you need to. This is less of a balance exercise and more to check on your hip strength. Good. Everybody doing okay there?
I think so. I think we're identifying maybe some strengths and less strengths.
Yes, I like the opportunities for improvement. All right, just got a couple more. All right. So everyone's squat is going to look a little different. Some of you may have been told to change your foot position. If toeing out is more comfortable for you, that may just be how you're made. So everyone's gonna look slightly different, but the goal is to get 5 times 2 parallel, like this picture, without your heels lifting or without rounding your back. So everyone try that right now. 5 squats, parallel, and back up. Just notice what you feel. You might have some creaking in your knees. Like me, a little clicking here and there. Good. And this one actually is pretty important as we get older too. Squats obviously are very functional, and quad strength or thigh strength is positively correlated with quality of life as we get older. So do your squats. And then last, this one's gonna be the most challenging. So again, if you had difficulty with single leg balance, make sure you're hanging on to something. We're gonna try single leg squats. Now, good form for this, you're gonna try not to dip your hips and you're gonna try not to lean. Okay, now we don't have to go as deep on this one. You're gonna try to get to about 45 degrees and then come back up. Try for 5 on each side.
Oh.
Try not to lean. You can look at a partner and see if they're leaning or cheating.
Can you cheat if you can't do it?
Probably not. Probably not.
We've got a lot of questions about cracking. Cause for concern.
Ooh, that's good. We can address
We
that.
can talk about that in our Q&A.
Yes, we can. All right. Whew. Everybody can sit down. That is the end of our strength and stability assessment. Some water. All right. Did anyone find something that surprised them? Anything that they feel like, oh, this is a little shocking that I can't do this, or I did really well on this? Any opportunities for improvement?
I definitely noticed my balance was better than I thought it was going to be. But we have someone here who has a thought.
Great.
So my name is Yuri, and I have osteoarthritis in the knee. And before your talk, I've been too scared to try any kind of movement. But because of what you said, I felt like I had permission to move my body in ways that I haven't, like bending my knees, where I have the osteoarthritis. So I'm glad to hear that I can still do things and not limit myself within reason.
So just for those of us joining virtually, I'll kind of repeat what he said. He said he was dealing with some osteoarthritis, was a little nervous to move, but decided to do it, and stronger than he thinks.
Awesome. That is so great to hear. We could definitely talk about osteoarthritis towards the end as well. So great to hear that. Anybody else?
A couple people in our chat, the single leg calf raises were more challenging than we thought, and then Allie said she did really well and she was really happy about that. That's awesome.
Awesome. Yeah, the calf. So we talked about the thigh strength and the quads a little bit associated with higher quality of life as we get older. And calf muscles, interestingly enough, atrophy faster than other muscle groups as we get older too. So that's an important one, even if you felt great with it, to put into your own program, whether it's single leg or double leg, just start to work your calf muscles. They're really important in walking and running as well. And again, just as like a preventative measure, because we know that they do get weaker preferentially as we age, oddly enough.
It's interesting. All right, we got another one here. So they'll say it and then I'll repeat it so people on Zoom will be able to hear us. Go for it, Kelly.
I find that I'm so much weaker on one side than the other, and so I wonder about like exercises you can do or to worry about, being weak on one side as opposed to the other.
So what she said was that she notices a big difference between the weakness from one side to the other, and I was just wondering if there's a way to overcome that, or if that's a problem, or if it's not.
Yeah, that's a great question. So most of us will have one side that's stronger than the other. So I'd say within a certain norm or a certain amount that's normal. With that said, you can always work on making it more symmetrical. If you've had one side that's been injured, it's kind of a chicken or the egg situation. Is it weaker because it's been injured, or did it get injured because it was weaker previously? It's really impossible to tell. But generally speaking, I don't think that would become an issue. But I would definitely, it's my bias to work on strength on both sides, and you'll probably see more changes in the side that you feel is a little bit weaker. But I wouldn't just preferentially only strengthen the side that you feel is weaker. You could strengthen both sides and be just fine. That answer that?
Yeah, that's cool. Yeah.
So I wish that I could provide each of you with your own individualized strength program today and stability program to help with injury prevention, but we don't have enough time. And even with an optimal program, injuries can and will occur, as you know. So I want to briefly go over the most up-to-date info on how you can handle injuries when they do happen. Now, of course, I recommend seeing someone, maybe a physical therapist, if you do get injured. However, I think, again, I'm hoping to leave you feeling empowered with certain issues that arise. And I think for the most part, we actually over-medicalize a lot of issues. And again, this is coming back to soft tissue injuries. Obviously, if you have a traumatic injury or, an appendix burst or something like that, definitely seek medical care. But I do want to address some myths that happen in musculoskeletal treatment and how you can, facilitate the process of healing as quickly as possible. So of course, had to bring in David one more time. Oh, okay. So all of you have probably heard of what immediately to do when you get injured. Is it this? Ringo Starr? Everyone think of Ringo Starr right when you get injured? Maybe not. So now I want you to. So everyone's heard of RICE, correct? Right? Rest, ice, compress, elevate, right when you get injured. No more RICE, okay? It's been debunked. Now we want you to give your tissues peace and love. Yes, exactly. So immediately after injury, think peace. E is for protect, E is elevate, avoid anti-inflammatories, compress, and educate. So protect means to unload or restrict movement for 1 to 3 days to avoid aggravating the area. I think the best example immediately we think of probably an ankle sprain, right? So offload or decrease the load on it, walking as much as possible to promote healing. With that said, we actually want to minimize rest. So the R in RICE was rest. We found out that rest can actually decrease tissue strength. So we want to rest as little as possible.
Oh.
And then elevate. So generally speaking, you want your limb higher than your heart to promote the reduction in swelling. There's really not much evidence that this helps, but the risk to benefit ratio is pretty low. So this is something you could do, but if you forget the E, you just want pace and love, that's completely okay too. It doesn't really work with the acronym, but you can skip the E if you'd like.
Pace yourself.
Pace, yeah. Then this is probably a big one, avoid anti-inflammatories. So our body causes inflammation for a reason, right? And so we actually don't want to inhibit that. Sorry about the dog. We don't want to inhibit that natural process by taking anti-inflammatories right away. Now, for pain relief, something like acetaminophen or Tylenol would be okay because it's not an anti-inflammatory, it's just an analgesic, meaning it's just a pain reliever. But things like ibuprofen, you want to avoid early in that healing process. The C is for compress. Bandages and wraps have been shown to decrease pain and may help with getting the swelling out. And then educate. So that's my job, but also now you can educate your friends. And what we want to educate on is obviously throwing out RICE and also an active approach to recovery. So things that are passive, like things being done to you, hands-on therapy, electrotherapy, acupuncture, stuff like that, have very little benefit in the immediate days after injury. And there's actually better outcomes with having that active approach of minimizing rest, elevating, compressing, and then the next part, which is love. So after those first few days, give those tissues love. So L is for load. We talked about load earlier. And early on, you want to unload, and then you want to introduce load as quickly as possible. So that would be like mechanical stress, like starting to walk after an ankle sprain, as long as it's not fractured. And you want to add that early really as soon as possible. Now you want to also be respect your pain limits. So you're trying to minimize or have no pain as you load this tissue, but it actually promotes tissue repair and then works you back toward tolerating the activities that you want to do quicker than staying without any added load. O is for optimism. So optimistic expectations are associated with better outcomes. So knowing that your body is capable of healing, it can adapt to this, and you're going to be okay actually leads you to do better. V is for vascularization. So cardiovascular activity is actually a cornerstone in managing musculoskeletal injuries. So even if you can't do anything with your lower body right away, say in the case of an ankle sprain again, if you get on an arm bike or do some kayaking or something that gets your heart rate up, it's going to promote blood flow to that area and again, promote tissue healing. And beyond that, it just helps you feel like you're doing something again. For active people, when that's taken away, you kind of lose a part of your identity. If you can't do the thing that that really makes you manage your stress well. It helps you just have kind of your own time with your thoughts. And so doing something to get your heart rate up can help with your mood and motivation. And then E is for exercise. So starting some low-level exercise to improve or bring back your range of motion, your strength, and proprioception. So basically your ability, the ability of your body to know where you are in space, which helps with your stability. Bringing in exercise can help with all of that. Now, we can also go into a few others, but with RICE, you may be wondering about ICE. So it was rest, ice, compress, elevate. So ICE has actually also been debunked as a modality that helps with healing. And this is still commonly used in my profession too. And the guy who created the RICE acronym actually came out in 2014 against it and said, oh, hey, actually, I was wrong. ICE doesn't help your healing. Sorry about that. And so it's similar to the anti-inflammatory medications in that if your body's providing these chemicals to bring in good stuff and take out the bad stuff after injury, ICE can actually slow down that process and delay your healing. So that should not be first-line treatment after an injury, even though it's still very widely used. Now, again, it does decrease pain. So if you're in a spot where you do not want to take Tylenol or something for a higher, like opioids obviously are not ideal. But if you're in a lot of pain and you do not want to take medications, ICE can obviously decrease your pain because it has that effect of numbing, but know that it might delay your healing process. And then the ever popular hypervolts, foam rollers, and lacrosse balls. Those are completely fine. There's no negative side effects. But I think it's important for people to know what they do and don't do. So we are often told that they break up scar tissue or adhesions. And unfortunately, but also fortunately, our tissues are actually so strong that these just cannot have a negligible effect on any scar tissue. It also has a pretty minimal effect on flexibility. It's not meaningful though. It lasts about 10 minutes. So if you're on a foam roller, you're gonna have improved motion for about 10 minutes after using that foam roller. So in that time, if you started to do some strength exercises into your new flexible range of motion, that's where it could definitely be of benefit. In addition, these modalities do increase blood flow, so they help you feel more warmed up, and they actually can help you decrease the soreness that you feel or perceived soreness after a workout. So ultimately, totally up to you whether you want to use these. And I think if they feel good for you and they help you with your soreness and warm up, awesome, keep doing that. If you're not sure if you get benefit, that's okay too. And happy to talk about any other modalities that you've heard of that you've done. And again, there are real effects of these though as well. So if you have knee pain and you use the foam roller on your quads and it helps your knees feel better, I'm not disputing that. Definitely keep doing that. So it does have real effects. This is all obviously in the research, which is not necessarily true to you or to real life. So I don't want to discourage you from things that make you feel better. And then ultimately, for optimal injury prevention and recovery, unfortunately, I don't have any magic fairy dust. I'm still looking for it. But sleep is huge. There's a podcast called The Huberman Lab with a neurobiologist named Andrew Huberman that I just listened to this morning about, and he talked to a sleep researcher, and it's just fascinating, the stages of sleep we go through and how important that is to our recovery. And of course, exercise. So we talked about strength and stability. Other components of exercise that are important are aerobic, like cardiovascular that we discussed. And then anaerobic is stuff that really gets your heart rate up, like high intensity activity. Obviously, these are things that if you have any conditions you want to talk to your doctor about doing before you jump into them, and of course, gradually. And some things that you might take away from today, you could hone in on some of those opportunities for improvement. So if you felt like it was really hard to do a heel raise, maybe start adding in some calf muscle work to your program. And then nutrition and stress management. And those are outside of my scope, but definitely recommend seeing counselors, therapists, registered dietitians, any other healthcare practitioners kind of in that holistic realm. I think everyone should be seeing someone like that, whether just once or on a regular basis, for optimal overall health. And then for an optimal exercise program, of course, you can see a physical therapist. I also do strength and run coaching. So if you're interested in programming or want the name of someone in your area, I'd be happy to let you know that or refer you to someone. And that is it. Thank you all so much for being here. I absolutely loved being here with you. And Katie, you're just such a vibrant personality. It was really, really fun to chat with you. And we'll take questions, and then here is my contact info.
Oh, good. Well, we can send this out as well to make sure people can get in touch with you. That was a lot of information. So good. We've got a couple of questions in the chat, but if anyone has a question here, or if you have more questions, drop them in. But we'll start with a couple. The first question was, what are some things specifically to look out as you're aging? So if you all of a sudden find yourself that you're aging, is anything you should do differently or change so that you can maintain an active lifestyle your whole life?
Yeah, absolutely. So as we get older, we do lose some tissue flexibility. So I don't advocate a ton of stretching for my runners just because we use smaller ranges of motion. But as we get older, that's where stretching, mobility work, yoga really come in handy. Stretching, it's hard to say. The evidence is mixed on whether it prevents injuries, but anecdotally with my clients, doing mobility work and stretching helps them feel better. And I think feeling better is going to reduce injuries. So we definitely want to incorporate some sort of, it could be yoga. If you don't like yoga, just doing some basic stretches daily, I think would be helpful. In addition, like I mentioned, calf strength is lost preferentially, and that's really important in walking. So obviously we want to prevent any falls while we're walking. So doing those heel raise exercises, incorporating those regularly would be helpful, as well as quad strength or thigh strength. So squats are going to be helpful for that too. And that's correlated with a decreased fall risk as well. In addition, since we do get a little bit stiffer, you're likely going to want a little bit longer warm up. So before jumping into anything high intensity, spend 10, even 15 minutes doing some body weight stuff. I usually go for a fast walk where you can hop on a bike for 5 to 10 minutes, something that gets your heart rate up. And you might see that warm up time just really extends until you feel ready to do something that's higher intensity.
Awesome. Okay, this is maybe like a rapid fire, but people have questions about like all these things. Do they work? Are they beneficial? What should you do? And so that's massage, the TENS machine, which I know that's been recommended to my parents like 1,000 times. And then reflexology.
Massage definitely helps decrease tissue tension. It helps people feel better. Again, it's not going to be breaking up adhesions, but that doesn't mean you can't feel better. Again, our tissues are so strong that the strongest person could not break up any like knots in the muscles. Again, it will help you feel like that. And that's just as important. But I think it's also important to know that your tissues are really strong and resilient. And the manual therapy or massage works by, it's still not super clear, not well understood, but part of it is that there's proprioceptors and mechanoreceptors in your skin and your muscles. And when there's input, it sends a muscle or a signal up to your brain, which then can inhibit muscle tension coming back down from your brain. So it does help you feel looser. It does help decrease pain. It does all of these things, but not for the reasons we previously thought, which was breaking up adhesion. So totally for it. I don't know that there's evidence that it improves performance, but if you don't have performance goals, then it doesn't matter. Reflexology, I don't know enough about to comment on, unfortunately. And TENS. TENS does work for pain relief because similar to manual therapy, it has this system where basically the signals go up to where you interpret pain, and it blocks these like pain gates basically. And so the pain signals then do not come back down to that area or are inhibited. So TENS machines won't help with like a recovering tissue like exercise will to improve your tolerance or improve your capacity. However, it will help with pain relief.
It's interesting. You know, I think like what non-scientists and non-professionals have learned throughout COVID is that like science is always changing the more information we get. And that's what I'm hearing so much from you, of that we're learning and getting better and adapting. And
exactly.
I would prefer things not to change, but that's just not science.
Nope. And yeah, in 5 years, they're probably going to be like, actually, we were all wrong again. Ice is good for you.
Like ice. Every time I call my mom and I'm hurt, she's like, Motrin and ice, drink some water.
Yeah, and she might be right in 5 years. So she might be ahead of the game. It's constantly evolving. So
well, I think we have a live question. What do we got? And I'll repeat it for those of you on Zoom.
Hi, I'm flying and I burn, like I'm beating up my leg, just they're really sore now. Do you recommend like any vitamins, protein that I should be doing, or just even in general for working out a lot?
Okay, so she said she started a running routine and now her legs are super sore all the time. Any like vitamins, supplement, diet, or anything else she can do so she can keep running, not be so sore?
oh, that's a good question. Supplements and diet are probably a little bit out of my scope. I would say though, I would make sure you're hydrating, especially if you've been running in this heat. There's not a great recommendation on hydration. You know, sometimes we hear half your body weight in ounces per day. I think that's probably a good place to start, but everyone's going to be a little bit different. And then I also recommend for my runners and myself too, if the run or the total time I'm out there, including walking, is greater than an hour, I'm taking a hydration beverage with me. So there's things like the brands that are common are Tailwind, which is a vegan one, Noon, Scratch, Osmo, something that has carbohydrates and sodium in it. And that'll help with hydration and possibly decrease soreness. The other thing I would encourage you to do, and I encourage everyone to do, is run slower. Most runners are running at a rate of perceived exertion or a self-rated perceived exertion of 5 to 6 out of 10. And usually that's just a little bit too high for us to recover from. So on your next run, I would try, if you're not already, I would try slowing down your pace by a minute. It can really mess with your ego. I've been working on that myself. But slowing your run down, or even doing a fast walk in between, doing some fast walks in between the run intervals, and really challenging yourself to be at like a conversation pace or an RPE, or rate of perceived exertion, of 3 out of 10, and see over time if that changes. But it's also totally normal as you get into a new program, as long as you're, not super sore for 24 plus hours, to have some soreness as you get into it. But it may just mean to take a little bit of a step back as your body adapts.
Awesome. You got any follow-up to that? We have a question in the chat. Catherine, you can elaborate if you want to come off mute or add more, but I'm going to expand your question. So her question is, what if your knees are tight? So either you notice that when you're working out, or you notice that in the strength assessment. I know the knees seem like a sensitive joint.
Yeah, definitely. Yeah. So there's a couple different spots you could work on mobility. That would be your thighs or your quads. So possibly stretching there, or your calf muscles or the hamstrings, which are behind, basically on the back of your thigh. The other thing, I think we often, at least in my profession again, confuse tightness for weakness. So it may be that your knees need a more gradual exposure to that activity. So actually doing more squats, at a very progressive level. And that's something that, getting help with a trainer or a coach with can be good. But I've found with my own knees that slowing down my running, because actually there was someone who mentioned osteoarthritis. I, as a 30-year-old, have severe osteoarthritis in my right knee. And I'm still able, I backed off on my running and I'm still able to run almost as much as I want, but it took backing off, doing more of the stuff that was bothering me, but at a much lower level, and then gradually increasing it. So it's possible that either you might need some mobility work, or potentially just work on that, doing that activity a little bit more over time and more gradually to build up the strength around your knees and support the joint.
Interesting. That feels very counterintuitive, but
Yeah, because if you think about, like, our muscles are actually shock absorbers for our joints. And with osteoarthritis, basically you lose some of the internal shock absorption. So we've also got structures within the joint capsule. So think of like a Ziploc baggie around the knee, and you've got structures within there that help with shock absorption. So if you lose those over time for whatever reason, your other option that you can actually facilitate more shock absorption with is to build up more muscle around the knee.
Cool.
Yeah.
Really cool. Well, we'll do one more question. I'm wondering, like, what's your soapbox thing? Like, someone comes in and to your office and says this, and you're like, oh, who told them that? I wish they knew XYZ.
There's probably a couple, but it really comes back to, like, there's something wrong with you that only I can fix, or that I need to fix. And oftentimes it's that your pelvis is out of alignment, or your spine is out of alignment, or gosh, what else? That your glutes aren't firing. It's probably one of those three. And it's just, it's just not true. And the reason it bothers me is that it's disempowering. And those are things, again, that feel like, wow, I need someone else's help for this for the rest of my life. When in actuality, there are so many things that we can do, and you have more self-efficacy and feel like, oh, wow, I can take control of this and actually get stronger to help myself fix whatever's been going on.
Yeah, that's awesome. That makes me feel better. I know that I sometimes walk into the doctor's office and I feel like I'm equipped with my Dr. WebMD knowledge, but I know it's a vulnerable position, I think, to be the client or the patient. So that's helpful because we do have options.
Yeah.
Cool. Well, that'll wrap us up for today. Again, her contact information is here, and we'll send that out as well. And then the recording of this will end up on the College of Health Solutions YouTube page. We'll share that out. But mostly we're super thankful that everyone joined us today. And of course, Steph, thanks so much for sharing all of this with us. We really appreciate it.
Yes, thank you so much for being here. It was a lot of fun.
Well, this is fun. We're waving in person. You hear the applause? And we'll